So we're live on YouTube, so I want to thank everybody for coming today. The bottom line is we need to talk about improving soft tissue compliance, right? Elasticity, strength, to get both stability, range of motion, and power, ultimately, for our athletes, right? So we're talking about the muscle, but also the tendon, the myotendinous junction, our non-contractile agents, ligaments and capsules. We can impact them. So how are we going to get positive results on that? And fascia. Fascia is huge. 30% of muscle fibers attached to fascia. So we just did muscle testing. Maybe it's pulling on fascia, and maybe there's a fascial dysfunction, and that's not really muscular dysfunction. So that's kind of huge. So let's look at this slide. The next couple slides are from this article here about hyaluron. So over here's the skin, deep reticular cortex, and then you get your first layer of deep fascia, and then over here you have a fasciocyte, all right? And fasciocytes, well, what do? We think they make hyaluronic acid, okay? Hyaluronic acid is the foundation of the extracellular matrix. When the extracellular matrix gets dense, gets viscous, it sticks. Things stick. So we want the extracellular matrix to be loose, to be fluid. We want these strands of hyaluronic acid to be long. When they get short, things get stuck together. Now, hyaluronic acid is around all tissues. Extracellular matrix is around all tissues. Good tissue and bad tissue. We don't know if the tissue drives the hyaluronic acid formation, like cancer cells have hyaluronic acid around them too, or if the hyaluronic acid drives the tissue. We don't know that yet. But down here, you also have some fibroblasts in here. Fibroblasts make collagen. Fibroblasts make elastin, so we like fibroblasts. All right? Some more fasciocytes, another layer of deep fascia, and then the muscle. So when this gets all matted together, here's your fibroblasts over there. When this gets matted together, that's when you lose your compliance in your soft tissues. Okay? And again, when you talk about fascia, fascia surrounds not just muscles. It surrounds everything. Your organs, your nerves, everything. All right? And this is what we want to impact. We want to get that gliding so the muscle gives us better compliance. The hyaluronic acid in the extracellular matrix is more viscous, and then we're going to have better tissue compliance. So, hyaluronic acid, all the same stuff we talked about. For two surfaces, need to be a lubrication, that's where it's going to be. It means viscosity of the synovial fluid. Ooh, cool. So if we stimulate hyaluronic acid, it's going to help synovial joints. Removes free radicals. It's important in wound healing, all cellular functions. Why? Because it's the extracellular matrix. Hyaluronic acid is the foundation. So if you have a healthy extracellular matrix, cellular function is going to be better. That's the bottom line. When we talk about fasciocytes, we believe make the hyaline-rich extracellular matrix, but the fibroblasts give us collagen and elastin. The course next month is going to go into depth about that article. What we're going to talk about today is how to improve HA fluidity, which means manual therapies that form the fascia. Give us better lubrication. They can reverse those small hyaluronic acid fragments and make them long and stringy, which is what we want. All right? Increased temperature does that, but it's got to get down to the fasciocytes. All right? And local alkalization can provide that as well. So how are we going to do that? Right here. Increases in the subcutaneous temperature by manipulation, physical therapies that create deep heat. All right? Steco manipulation. You rub, you rub, you rub, you rub, you rub until it loosens. Works great. Takes a lot of time. We're creating heat and friction, cross-friction massage, same thing. Takes time. We're getting blood in there and we're creating friction and heat. But that's what we need to do. There's another article just came out. Densifications, that means thickening. Okay, when that when those layers stick together. Painful densifications in the fascial system can be treated by increasing heat using manual therapeutic interventions directed to the area that's tight. That's us. That's NIMO. That's fascial release. That's ART, yeah, right? But what else can we do? We can do it with energy. We can do it with transfer of energy, capacitive resistance, TECR. What is it? It's an emotion of high frequency waves, 300 kilohertz to 1.2 megahertz. It's a monopolar alternating current for our technical people out there, like a sine wave. But it transfers energy and it stimulates at the cellular level the fasciocytes and the fibroblasts, which means you get hyaluronic acid, which means you get better cell function, which means you get better vascularity, which means you get heat at the cellular level, which promotes oxyhemoglobin concentration and metabolism. So the cells just work better. Now, we have some references that talk about it, but that's the bottom line in a nutshell. The big name for TECR or endogenous thermotherapy. I think it's kind of a type of dietherapy, just ramped up on steroids, but that's just my opinion. I haven't seen that written anywhere, but it does, it's not as superficial, it's a deep heat. So what does endogenous thermotherapy do? It relaxes tissues, because it penetrates. Gives that deep muscle heating, gives you better hemoglobin saturation, but the blood circulating dissipates heat. Does not interface with the bones or prostheses. So you don't get that friction interface like with ultrasound, all right? So you can do it over prostheses. And the circulating blood helps maintain the temperature internally within normal limits. It's interesting when you start to crank it up too much, it doesn't always get hot on the skin. Sometimes it feels like an electrical pinch. So it's kind of interesting. But all you feel is a warmth. But the circulating blood helps prevent too much heat. You don't want to burn. But it can happen superficially. To myself, I think. But that's how you learn. And those are the references on that. So this is what it is. This is not an exact concept, but think of it like ultrasound. It's a sine wave. Ultrasound at 1 hertz it will penetrate less than an ultrasound at 3 hertz. Sorry, I got it backwards. 1 hertz will penetrate deeper, like waves, slow waves. Penetrates deeper. Then you have waves coming fast, they don't penetrate as well. All right? Same type of thing. So they have different frequencies. They call it capacitive mode. Well, that's going to be more superficial. It's going to focus in on the muscles, on the tendons, tissues that are more fluid in them. Okay? Whereas you're going to have a resistive mode, a different frequency. It's going to be a lower frequency, so you're going to get more penetration. So your capacitive mode's a little higher, close to 300. Close to 1,000, and your resistance is going to be closer to 300, and then you can get different levels of penetration. That's why it's kind of cool. So your resistance mode is going to be more with bones, ligaments, and tendons. Since this is more superficial, where are our temperature sensating? They're in superficial, they're in the skin. So you're going to feel more heat because it's more superficial, because that's where your temperature sensation neurons are, receptors, all right? So those are your basic frequencies, all right? What happens at the cellular level? We're opening up the calcium channels. By opening up the calcium channels, nutrients get in and out better. And it's going to give us better permeability of the cell membrane, which just stimulates metabolism. But we know, just thinking about a moment ago, getting more vascularity and heat, it's going to do that as well. So it's pretty cool stuff. This is a visual of what we talked about just a moment ago. Very superficial, like a star, 1,000 kilohertz. The original, if I'm correct, the original work in Europe with this was cosmetic. High frequency for cosmetic. Why? Any doctors in here know what hyaluronic acid is used for in the beauty industry? A little louder. Wrinkles, right? Huge, huge. So if we can stimulate hyaluronic acid, you think, my daughter's an acupuncturist. She says people come to her office and they pay big money for electrical treatment on their face for wrinkles. And it's stimulating hyaluronic acid. That's all it's doing. We can do the same thing with the Tech. So anyway, 1,000, then 500 to 300, it's going to be your subcutaneous fascia. 300 is going to be your deeper fascia. But look, we can hook this up to our hands, and it can come to our hands. So now, as a manual therapist, we can have the energy transferring from the machine through our hands, because we wear bracelets, and we can feel the tissues and treat the tissues at the same time. Or we can have the patient actually move and do it passively. That's some fun stuff we're going to play with in a moment. So you can get down to the cartilage in the joint, or you can just do it more on the myotendinous junction, or you can do it more superficially all the way to scar. So it's pretty cool stuff. So transfer of energy, capacitor resistance, TechR, the lower frequency waves penetrate deeper. Increase in temperature, you get that microcirculation, better blood flow, better vascularization, reduces inflammation, reduces swelling, reduces pain, and accelerates healing. That's what it does in a nutshell. And we're going to do some breakouts on that right now. Another paper, just to throw some papers at you. It's characterized as a non-invasive, high-frequency energy that awakens the body's ability to heal. Why? Because it stimulates function at the cellular level, brings in blood, opens up the channels, stimulates hyaluronic acid production, and extracellular matrix. And it promotes metabolism by transferring energy without an external source. It's an internal out type of heat. Why would we want to use it on tendinosis? We already talked about it. It's going to activate fasciocytes and fibroblasts. So you're going to get new cells, you're going to get better blood flow, you're going to get better healing. It just makes sense. Now, is it a standalone? Nothing's a standalone. This is an adjunct. It's something you want to add to your toolbox. So when would you add this to your toolbox? When you want to get more blood into the area, when you want to get some analgesic effect, when you want to soften stuff. For those patients that come in and say, boy, heat makes me feel really good, those are fascial densification patients. Those are the patients that have fascial densification, all right? And then a lot of people use this before they try to do deeper therapies like shockwave. Kind of prepares the tissue for shockwave, okay? Or if they're going to be doing even grafting, because it kind of loosens things up, gets things more prepared. And then for pain control, sometimes people use laser at the end. That's Ed. That's Ed's MRI. He was one of our first patients. We used TechR, okay? About 3 weeks of treatment. Ed had much abduction or external rotation? No. Okay? And he's doing great. He comes up, very rotates, got full range of motion in his shoulder. And it's why just relax the soft tissues around it. We can make that spur go away. That spur's still there. He just has better tissue compliance. All right? You can watch his full story on my YouTube channel. All right, so we're going to go do a breakout, a lab with TechR and muscle testing. If you have a pacemaker, insulin pump, cancer, pregnancy, if you can't feel heat, all right, or over an area that can't feel heat, do not do this therapy. All right, if you have any circulatory issues, again, because you're going to have blood flowing through, thrombophlebitis, DVTs, right? So if you have those situations, you can be the physician, but not the patient today. Yes.
Pregnancy in terms of area, can you work on an upper extremity on something?
Yeah, you just don't want the therapy to go through that area. Yeah, yeah. But you know, let's face it, pregnancies are relative contraindication for everything.
Right, that's what
You know, because nobody wants to test it. You know,
Right.
right? It is that simple. You know, so
liability.
Yeah, so when in doubt, say no. So even though it's not an absolute contraindication, but we just had a gal in yesterday, it's a college in Ellis Danos, and she's got some motility issues in her gut. This works great for her. Go figure. It's just improving tissue compliance, you know. So yeah, I would say no. Johns Hopkins, I believe, has 7 of these units just doing pelvic floor. Yeah,
Wow, that's a lot.
I'm waiting to learn what they do, because
Yeah.
they don't want to do something on that. But definitely let them read about that.
Yeah,
you know.
that's big.
Okay, so let's come on over here. It's gonna be a 2-part lab. So Dr. Slade, why don't you mind taking your shirt off for us, please? Actually, so real quick. No. I'll just stand here. Just stand over there for us real quick. So let's say Dr. Slade's, face us. Let's say Dr. Slade's already had his eval, he's in for a follow-up visit, all right? We're monitoring an impingement syndrome on his left shoulder, let's just say. So we'd have him come in and say, all right, just raise your arms up like that. How's that feel today? You know, and he would let us know it hurts, it doesn't hurt, where it hurts. Is it a painful arc, right? How about going out to the side? Any pain? How's that feel today? Feels pretty good today, all right. So, at that point, turn your back towards us, which is what he's going to say. Just bring your arms out to 90 degrees. And right there, you're looking for that symmetrical development. Just take a look, see, and that's nice. He's got nice traps, but they aren't overriding these. He's got nice development in through here. You can see his Terry's grooves. Balance. Balance. He doesn't have to be a bodybuilder, but he sees balance. So have a seat for a second. I think right there, face that way is fine. So let's say we want to get some warmth in through that area. How's that? Hold that for a second. Let's get some blood in there.
No.
So it's energy, right? So it's got to go from one place to another, right? It has to go from one place to another. So we're going to use a pad to act kind of as a rounding pad. And then we're going to use one that's got a C on it. So what do you think it's going to be, capacitive or resistance? Capacitive. Do you think this is going to be more superficial or deep? Capacitive is going to be more superficial, right? All right. Now we can control the
That's the
Yeah.
faster way, right?
I'm sorry?
That's a higher,
Doc, is that low?
Yeah, exactly, it's gonna be a higher frequency, okay? Now, we know Dr. Slade doesn't have a pacemaker, he doesn't have an insulin pump, he's been properly evaluated.
Is she
to
pregnant
Make
though?
sure that there's no,
probably not right.
yes,
Well, I
probably
don't know.
not pregnant.
Some
So,
people say men
flip
can get
these.
pregnant.
So, there you go. Now, we can gauge the intensity. The intensity right now is 40%, and let us know if he's getting any heat. Coming up now. And then he can start, and I can start to feel it under my hands. So this can just be some heat, all right? But what he can also do is, let's go into forward flexion and down. So let's say you had that painful arc from 80 to 110 degrees, right? I could be doing heat over his infraspinatus, supraspinatus, while he's pumping it. Now we want to get some blood into the area, and this is going right through the shoulder. If I come up here, it's going through the supraspinatus.
Is there any contraindication to staying immobile, or is it constant?
Well, now this is going to create heat, right? So this one you kind of move a little bit, okay? Unless I set it, I can put it on a special setting over here for less heat, for athermic type of approach, but it's still gonna get warm, okay? And he'll tell you if it gets too hot. And we did put a little lotion on the skin as a conductant. It's kind of an emollient, it's not a water-based, it's got a little oil in it. How's that feel?
Yeah, I feel heat, feels good. Feels really good.
Any different than a moment ago, this frequency versus the other one?
Maybe a little bit less.
A little bit less. I have it on an athermic, I'm moving a little bit slow. So, come on over here, doctor. Here,
Okay.
grab that, sure, that in your hand. Just put that one there. I would move that like an ultrasound in the beginning. And he feels the heat. What do
I
you
the
feel?
heat.
Yeah,
Yeah.
you just feel a little bit of gentle warmth. Now, he can be exercising or not exercising. He can be stationary or not. It's just, that whole point is we're just getting a little bit of blood through the tissues. Stimulating I mean, I'm so jazzed. We're stimulating fascia, the fascia sites, the fibroblasts, we're making hyaluronic acid, we're making collagen, we're making elastin.
You feel it.
How
when
can
there's
this not be-
as much muscle in those spots, but like when there's more muscle, you feel a little
That's
bit
right.
less. Like when you're long bone, you feel a little bit more, but it's not too much.
So now to answer your question, keep going with that. We'll change.
But you can get in there. You know what I mean? You can still get in there.
Okay, so, yeah, it takes a tab of lotion.
Yeah, it's got a little dry.
Okay, I'll pause it for a second. Just give me that one. Get that one. Okay, go ahead. Now, don't move the back one at all. Now, what's that say on it? C or R?
R.
R, so that's resistive. So it's gonna go a little deeper. Are we gonna get as much lower? And you're not gonna get as much heat. You don't have to move it. Now, this will warm up, okay? If you leave it there long enough, or if the skin gets too dry, you get a dry patch, he'll go, whoa!
Get a little
It won't burn him, but he'll just sense it. But where are you now? You're at 40%, which is a good amount, and you don't have to move it as much, but it's going through. So your arthritic joints,
Just feels-
you want to get into the synovial fluid.
If I do that, just.
How long would you leave it there?
I do about a 5-minute treatment. I
So
don't
you'll
leave it
keep
on
your
one
hands on-
spot. I'm focusing on.
That's what I mean, how long would you leave it at one spot in the arth?
You know, that's why I like having my hand this way, as opposed to, you can hold it like a ball, like that.
This way you hear.
That way you can really feel the tissue, and
Right.
that really guides it, because as the muscle releases
You
and
can feel
loosens,
You feel the contraction.
Yeah.
well,
No, it's.
it doesn't, no, it releases. It's not
That's
twitching.
how your hands feel.
Your hand feel, your hand, yeah. That's why I like to do it that way most of the time. Or if I'm holding it like a ball, I'm still using it like an instrument. Like, what does it feel like? That guides it. And also, again, you're being intentional.
And how
Going
long?
back to quantum biology, you know, you're being intentional. What am I trying to do? Am I trying to get to the meniscus? Am I trying to get to the cartilage? Am I trying to get to the subscap? Well, if I wanted to get to the subscap, I wouldn't be there.
Right.
I'd be coming up supine. 5, 8 minutes, depending on where it fits with your treatment protocol. Okay? So, how's that feel?
Yeah.
Comfortable?
And I feel the heat
Yeah.
now comparatively, not
Yeah.
like before, but.
But it's different, the sensation. So, let's continue with playing with this a little bit. All right, I want everybody to to swap through. So you want to get your hands either on yourself or Dr. Slater, we should feel it, okay, what it feels like. Who wants Renee to put, now that her hands are Dr. Renee has stuff on her hands, anybody want to see what it feels like? Come on, come on. You can show. All right, to our live YouTube audience, thanks for tuning in. Next month, we're going to be doing fascia and current concepts of fascial treatment. Thanks for tuning in. You mind taking your